if I think it's important to note that if a week in politics is a long time, and it is, just think about this. It's now 31 years since we last defeated the Conservatives and Roy became our premier. It's now 21 years since I was elected leader of the party and became premier, and it's now 14 years that the Sask Party has been in government. That's 2 generations. And so I think it is useful that once in a while we take a little time just to reflect and reminisce a bit about the years we were in government, and particularly to think about what New Democrats can accomplish when we are government. So I hope tonight I can do some of those things and have enough time. I hope we have for some questions and discussion. So looking back to 1991, the Conservatives under Grant Devine had governed for almost a decade. That 91 election was called one day after the legal limit of 5 years. Had it not been called, the lieutenant governor would have had to call that election. And in that decade, the Devine Conservatives had simply bankrupted the province through mismanagement, through sweetheart deals on mega projects, through excess and corruption that landed a bunch of them in the courts and some of them in jail. They left our province on the very teetering, on the very verge of bankruptcy. I so well remember a cabinet meeting that was in the boardroom of the Crown Investments Corporation on Victoria Street in Regina. Roy was in the chair. We were briefed of the possibility that we might not be able to make payroll for the public service. We were being denied access to any further borrowing, any further credit. Our credit rating had fallen so low, so desperate was the financial situation. And we were briefed that night on precisely what would happen if the province fell into bankruptcy. I don't know if any other cabinet in the history of the province has had that kind of briefing. And friends, I can tell you it took the skill of Roy Romano and our first Minister of Finance, Ed Trzowski, to negotiate with the bankers and the bond dealers in New York City and Toronto and Montreal, to negotiate with the Mulroney federal government to give us an extension on our credit, to give us sufficient time to start turning this mess around. And we made some draconian choices. We were forced to. We made cuts to the drug plan, the very drug plan that we had pioneered and built. It broke our hearts. It broke some of our hearts to be doing it. We had to hold the line on public sector contracts. We increased taxes. There was nothing that escaped our attention. I mean, for goodness sakes, we even took the free fishing license from seniors. And of course, we had to hold the line on healthcare being the largest single expenditure of government then and now. We simply had to hold the line on expenditures in health. And our challenge was to do that, to hold the line on healthcare expenditures, but at the same time, improve health services in the province. That was our challenge. Now, as Harold has pointed out, the SP continue to talk about the conversion of the 52 rural hospitals. Well, friends, know this. Of the 52 affected acute care facilities, of the 52, I think only 2, perhaps 3, but I think only 2 actually closed. That was Smeaton and Milton. The others, the 49 or 50 were all converted from acute care to health centers in the community, offering a broader range of services than the acute care services, which were no longer sustainable. Let me tell you a little story. This happened before the conversions. As the Associate Minister of Health in those days, I went to tour the new integrated facility at Imperial, the Long Lake integrated facility. That facility was under construction when we became government. And so in fact, it was Louise Simard, our first Minister of Health, who went and actually cut the ribbon on the Imperial integrated facility. It's a beautiful facility. And it was built as an integrated facility with the acute care wing on the one side and the long-term care wing on the other side. When I went into the facility, I could see into the long-term care wing. I could see it was fully occupied with residents. There was lots of activity, lots of staff. And then with the woman I was being toured by, we traveled towards the other side, and the lights weren't on. And I said to her, well, why are the lights not on? That's the acute care wing. And she said, yes, it is, but we have no patients in the building. A brand new facility, a first-class facility, not being utilized, no patients, the lights are turned off. So just for fun, this morning, I checked what programs are available today at the Long Lake Valley Integrated Health Center in Imperial. It was one of those that we converted. Well, here's what's available in Imperial today. 16 long-term care beds, 2 respite, palliative, or convalescent beds. There's an outpatient department. There's lab and x-ray services. There's a physiotherapist. There is a medical clinic in the facility where the doctor's available Tuesday to Thursdays. The public health nurse has appointments in the health facility. There are foot care clinics. There are child health clinics. There's a rehabilitation center, and there are home care services coming from the facility. The lights are on in the Imperial Health Center today, as opposed to acute care services that were not being utilized by the community. Yes, we were forced by the fiscal realities to have to look at some very significant change. But the fact of the matter is, in terms of acute care services in rural Saskatchewan, we were able, in fact, to broaden health services in Saskatchewan while we consolidated the acute care, and we were able to hold the line on the healthcare expenditure. Now, people in the Sask Party are talking about the situation with closure of schools. Well, the fact of the matter is, Judy Bradley's with us tonight. She can tell you from the point of view of education that we didn't close one school during our term in government in the 90s. Because in those days, decisions were made on a local basis by local communities who had the power to decide education in their community. And if a school was closed, it was on the basis of a decision made locally. We don't hide from the fact that we inherited a desperate situation. The Conservative debt crisis caused us to make some very hard decisions. And friends, when you hear someone from the Sask Party talking about the closure of rural hospitals, here's the question you need to ask them. They've been in government 14 years. Ask them, in which of those converted hospitals have they restored acute care services? And the answer, of course, in none, because it was the right public policy occasioned by the desperate circumstances we found ourselves in. And friends, I want you to mark this. We were able to survive those days because of the strength of Roy Romano and our first Minister of Finance, Ed Cherzowski. Give us the budgets and the discipline to put this province back on a sustainable fiscal foundation. And I can tell you, it was hell on wheels. It was hell, the cutbacks, the program eliminations, the tax increases, pleading with the people of Saskatchewan to buy the bonds, pleading with the financial houses to give us the credit. It was hell for the elected, and it was hell for the members of our party on the ground. I remember going home one night to Moose Jaw to the MLA office, and there was a drawing of me hung in effigy, pasted on the door of the constituency office. I wouldn't wish that circumstance on our worst political enemies, never mind on the people of Saskatchewan. But I kind of fear that with the seemingly inability of the SP government to balance a budget, even in the best of times, and with the amount of debt they're heaping on our children and grandchildren, it may just be that another NDP government will one more time have to clean up their mess. But I do also want to highlight one other thing from those years of the 90s, which in my view is one of the most significant accomplishments of Saskatchewan New Democrats in decades. So to better utilize our scarce resources in those days, achieve better outcomes for Saskatchewan families and Saskatchewan children, we created what we called the Child Action Plan, drawing the resources and programs of government and departments into working together for better outcomes for our families and our children. And a component of the Saskatchewan Child Action Plan was what we called the Child Benefit, Saskatchewan Child Benefit. And so just like Medicare 2 generations before, we started the Child Benefit in Saskatchewan. And just like Medicare, we went it alone. We funded it. We paid for it by ourselves until we could convince our provincial colleagues and the federal government to make it a national program. And when that happened, the Child Benefit became the first national social program since Medicare. And the Child Benefit, of course, has continued through government changes in Ottawa. In fact, I think it's actually improved. But my point is that even in the most desperate of fiscal and financial times, New Democrats in government are creative. And we find ways to strengthen the fabric of our families and our communities. New Democrats in Saskatchewan in the 90s created the Child Benefit. We provided it by ourselves to the people of Saskatchewan, and then we gave it to all Canadians. That's what New Democrats in government are about.